The adjustable in elbow and knee use the same joint. Okay? Very simple, very strong. This joint can be used for exceptionally high-tone patients. It is used in this position and also straight across the knee. First part of the adjustment is take the stop, unscrew it partially out, and gently pull back. When you pull back on the lever, it will release the gears. For flexion and extension, rotate the ears for flexion and extension, and it becomes incredibly strong and incredibly durable. This joint can be used with very high tension, and this joint also has an added feature. This screw can be loosened, and the whole assembly can be bent into a varus or valgus angle and reset, and still keep your range of motion. It can be used to and in that position in the knee, it can be used to unload a knee. Once you've set your position, once you've set your degrees of motion, screw back in the stop. Thusly, you're ready to go. It will not come back out. Once you lock it into position, it stays where it needs to be. Full range of motion. Unscrew it. Pull back on the lever. You can set it thusly. You can set it on an elbow that goes too far back. You can set it on an elbow almost to a zero flexion. Very simple.